Clinical toxicology. Definition. Toxicology is the study of how natural or man-made poisons which cause undesirable effects in living organisms. Clinical toxicology is concerned with diseases and illnesses associated with short-term or long-term exposure to toxic chemicals. Clinical toxicologists include emergency room physicians who must be familiar with the symptoms associated with exposure to a wide variety of toxic substances in order to administer the appropriate treatment. Toxicity. The word toxicity describes the degree to which a substance is poisonous or can cause injury. The toxicity depends on a variety of factors: dose, duration and route of exposure, shape and structure of the chemical itself, and individual human factors. Toxin. The term toxin usually is used when talking about toxic substances produced naturally. A toxin is any poisonous substance of microbial, bacteria or other tiny plants or animals, vegetable, or synthetic chemical origin that reacts with specific cellular components to kill cells, alter growth or development, or kill the organism. Toxic effects. This term refers to the health effects that occur due to exposure to a toxic substance, also known as a poisonous effect on the body. A poisoning case can present to a doctor or hospital in any one of a number of ways. Broadly, there are 4 types of presentation. 1. Fulminant produced by a massive dose. Death occurs very rapidly, sometimes without preceding symptoms, the patient appearing to collapse suddenly. 2. Acute produced by a single dose or several small doses taken in a short period. Onset of symptoms is abrupt. 3. Chronic produced by small doses taken over a long period. Onset is insidious. 4. Subacute characterized by a mixture of features of acute and chronic poisoning. The majority of poisoned patients presenting to the casualty, emergency department are victims of acute exposure. In most cases, the poisoned patient presents with one or more of the following nonspecific features. 1. Impairment of consciousness. 2. Respiratory, cardiovascular depression. 3. Dehydration due to vomiting, diarrhea. 4. Hypothermia. 5. Convulsions. 6. Cardiac arrhythmias. Toxic syndromes. Toxic syndrome or toxidrome is a constellation of toxic effects comprising a set of clinical fingerprints for a group of toxic chemicals. Toxic syndrome or toxidrome recognition is important because it provides a tool for rapid detection of the suspected cause and can focus the differential diagnosis to consideration of only a few chemicals with similar toxic effects. Types of toxic syndromes. 1. Anticholinergic syndrome. Causes: antihistamines, antiparkinsonian drugs, atropine, scopolamine, amantadine, antipsychotic drugs, antidepressants, antispasmodics, skeletal muscle relaxants, many plants, especially datura, and fungi, e.g. Amanita muscaria. Symptomatology: delirium with mumbling speech, tachycardia, dry hot skin, mydriasis, myoclonus, urinary retention, decreased bowel sounds. Convulsions and arrhythmias in severe cases. 2. Cholinergic syndrome. Causes: carbamates, organophosphates, parasympathomimetic drugs, and some mushrooms. Symptomatology: confusion, CNS depression, salivation, lacrimation, urinary and fecal incontinence, vomiting, sweating, fasciculations, seizures, meiosis, pulmonary edema, bradycardia. 3. Sympathomimetic syndrome. Causes: cocaine, amphetamines, upper respiratory decongestants, phenylpropanolamine, ephedrine, and pseudoephedrine. Symptomatology: paranoia, delusions, tachycardia, hypertension, hyperpyrexia, sweating, mydriasis, seizures, arrhythmias. 4. Sedative syndrome. Causes: opiates, barbiturates, benzodiazepines, ethanol, methaqualone, meprobamate, ethchlorvinol, glutathione, clonidine. Symptomatology: meiosis, hypotension, bradycardia, hypothermia, CNS depression, hyporeflexia, coma, rarely convulsions. Differential diagnosis. However, there are some valuable clues afforded on detailed clinical examination which can help narrow down the differential diagnosis. 1. Ocular clues. Several drugs, poisons affect the pupils of the eyes, producing either meiosis or mydriasis. A few produce nystagmus. Normally, both the pupils are equal in size, 3 to 4 mm under typical conditions, round, and react directly as well as consensually to increased light intensity by constricting. Pupillary constriction also occurs as part of the near reflex when a person focuses on near objects. Mydriasis can occur due to increased sympathetic stimulation by endogenous catecholamines or from systemic or ocular exposures to sympathomimetic drugs. Mydriasis can also result from inhibition of cholinergic-mediated pupillary constriction. Because pupillary constriction in response to light is a major determinant of pupil size, blindness from ocular, retinal, or optic nerve disorders also leads to mydriasis. Pupillary constriction or miosis can result from increased cholinergic stimulation or inhibition of sympathetic dilation. 2. Olfactory clues. Some poisons have distinctive odors which may be perceived in the vicinity of a poisoned patient, especially in the breath. E.g., odor, acetone, acrid, burnt rope, coal gas, etc. And substance, chloroform, ethanol, carbon monoxide, etc. 3. Dermal clues. Some poisons have characteristic dermal manifestations in acute toxicity, while certain others demonstrate skin signs on chronic exposure. E.g., organophosphates produce profuse sweating, arsenic produces raindrop pigmentation, hyperkeratosis, dermatitis. 4. Oral clues. Careful examination of the mouth can afford valuable information about the etiology of poisoning in some cases. E.g., cytotoxic drugs produce stomatitis, phenytoin and sodium valproate produce gingival hyperplasia. Thank you.